everyone, Diana here with In the Pink. We are your resource to help you find answers to your women's health questions. So if you're new to this channel, please consider hitting subscribe so you always know where to find me for your women's health questions. Today's video is going to be on the 7 breast symptoms you should never ignore. Stick around. Welcome back. My name is Diana. I'm a physician assistant and I've been practicing women's health for the past 11 years. Today we're going to talk about the 7 breast symptoms you should never ever ignore. These symptoms we are going to talk about could be symptoms of breast cancer. Not always. There are other things that can cause these symptoms too, but you never want to ignore them. Symptom number 1, breast lumps. Now the number 1 question I get from my patients is, how can I tell a difference between my normal breast tissue and an abnormal lump? And my answer for them is, become familiar with how you feel normally. Breast tissue is lumpy and bumpy in general, and sometimes it's hard to distinguish a normal lump from an abnormal lump. But if you know what your normal is, you're gonna be that much more likely to recognize if an abnormal lump arises. Now, an irregular lump is gonna be hard, irregularly shaped, and non-mobile, meaning you can't wiggle it in between your fingers. If you feel the top of your knuckle, that is what an abnormal lump might feel like. Symptom number 2, nipple discharge. Now, nipple discharge, of course, when you're breastfeeding is normal. That's called lactating and can be normal even up to 6 months after you stop breastfeeding. But if you notice discharge beyond this, or if you notice new nipple discharge, especially bloody discharge, that could be a sign that something abnormal is going on. Symptom number 3, change in the size or shape of a breast. Now, if your weight is fluctuating, it's normal for the size of your breast to fluctuate as well. But if you notice that one breast starts to become enlarged, lopsided, irregularly shaped, that's not normal, and if that happens, you should definitely have that checked out. Symptom number 4, a swelling underneath your armpit or above your collarbone. A swelling in one of those 2 areas could represent an enlarged lymph node. Now, enlarged lymph nodes in those 2 areas are rarely normal, and if you feel one of those 2 things, that definitely needs to be checked out by your medical provider. Symptom number 5, inverted nipple. If you start to notice over weeks to months that a nipple starts to go inside out or be inverted inwards, that could be a sign that a breast cancer or a tumor is pulling the nipple inwards. That's definitely not something you want to ignore. Go have that checked out. Symptom number 6, a change in the coloration or the thickness. If you notice that you develop what looks like a spider bite or a red rash that doesn't go away right away, or if you notice a change in the thickness or the consistency of your skin, possibly with little indentations in the skin, something that might look like the appearance of an orange, that's definitely abnormal. You definitely need to have that evaluated. Symptom number 7, dimpling of the skin. If you start to notice that the skin of your breast starts to dimple inwards, like it's getting grabbed from underneath, that could be a symptom of breast cancer. You can evaluate for this by just standing in front of a mirror right after you've gotten out of the shower and just look at your breasts. Then, still in front of the mirror, squeeze your hips with your hands and again look at your breasts. Next, you want to squeeze the palms of your hands above your head and again look at your breasts. You want to look for any changes, any dimpling like we talked about. Anything that looks abnormal or new is usually worth evaluating. Thanks for watching my video on the 7 breast symptoms you should never ignore. If you found this video informative, please remember to share it with your friends and family, and don't forget, men can get breast cancer too. If I mentioned a symptom that you didn't know about, chances are you might have a friend or a sister or a daughter or a mom who also didn't know about it. Share it with them and help to spread the word on the symptoms of breast cancer. If you have any of these symptoms, don't wait to have it checked out. Don't procrastinate making that appointment. Remember, the earlier the diagnosis, the better your chances are of beating this. Thanks again for watching. Just as a reminder, this video is intended to be informative and educational, but it is not intended to diagnose or treat you. So if you have any medical conditions that you're concerned about, make sure to have it checked out by your medical provider. If you have any questions or comments, please put it in the comment section below, and we'll see you next time.